So it looks like the patient is coming in showing signs that everything is wrong, says the nurse, okay? And was the nurse able to get any vitals? No. Okay. So they're gonna send them to me. Okay, let me ask to send the nurse for them to send them in. Okay, let's see how this patient is. Oh. Hello there. Welcome to the exam room. Are you here because a nurse requested that you get extra exams? Perfect. Please do come on in. I know I'm not your primary physician, but I am Dr. Lily. I'm the neurologist and specialist here at the clinic. And I was looking at your report. Looks like that nurse said that everything is wrong. Okay, well, we'll see if how that's actually really is. Could you please take a seat for me? Thank you. Just right at the table right there, okay? I'm gonna ask you just right now up front. Are there any problems with your eyes and visuals? A little bit? What seems to be the problem? Everything's a bit off, okay? And what about your stability? Have you been able to walk well? Do you feel like you've been a bit imbalanced? Okay, yes. And what about cognitive functions? Do you feel like you've slowed down a little bit, or you're unable to perform normal things that you used to? Okay, any signs of a cold, flu, or being sick? Okay, when was the last time you were sick? Okay, a really long time ago. Okay, did you hit your head recently? No? Okay, have you ever had a concussion? No. Okay, so we're gonna just do a lot of exams on you today. So the first thing we're gonna do is I'm going to ask if I can take your vitals, okay? And I'm going to hear for a heartbeat, okay? And it might be a bit cold. Just let me know. Okay, I'm gonna put this on your chest. Is that okay? Okay, good. Just want you to breathe in, okay? And breathe out. Breathe in and breathe out. Okay, let's find out about your heartbeat. Okay, are you really nervous right now? Okay, let's try breathing in again. And breathe out. Breathe in. Breathe out. I promise this should not make you feel anxious at all. Okay? Let's relax and try again. Okay. Okay. Okay, I'm going to check your back. Okay, breathe in. Breathe out. Okay, and let me check. Okay, so maybe you're just a bit anxious, okay? What I'm going to do is I'm going to use something on you. It is my pulse oximeter. I'm going to put this on your finger. And what we're going to do is we're just going to carefully check your finger for a pulse, okay? Just like that. I'm going to ask you just to sit there. I'm going to put this on your finger, okay? And we're just going to wait 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And yours came back with no result. So if you can actually see, that's no result. So I'm gonna just check that out. Let's see if I can grab a temperature from you. Can you just sit there? I'm gonna just scan your head. Okay. I'm gonna try this one more time. Okay. Let's see. Sit there. Here we go. Okay, and the machine just turned off. So that's a little peculiar. Mind if I get your blood pressure from you? Okay, could you put your arm out? Okay, so I have a little machine that will calculate your blood pressure. I'm gonna put this around your arm, okay? So just wrap this around your arm. Nothing to be worried about. Okay, so what we're gonna do is I'm just going to now just check your pulse. And I'm going to just use this little balloon here to calculate your blood pressure, okay? So just sit there. feel that at all? Okay. Excuse me, I'm just gonna take a quick look. So what I'm finding is, I'm gonna remove that off your arm actually, okay? So I've never seen that happen before. Okay, well, we did get the calculation that you're at 0, which is not true because I heard your heartbeat racing, so it's a little peculiar. Do you have any surgery growing up where you had metal pieces put in your body which would make it difficult for me to find things like this? No? Okay, so I'm just gonna write that down just a little bit. Nothing to be worried about, okay? Nothing at all. So I'm gonna do that. Now what I'm gonna do is I'm gonna quickly check your eyes. We're gonna move on to a cranial nerve exam, okay? I'm gonna ask you just to look at me, okay? And good. Don't look at the light. Don't get distracted. Look at the light. Don't look at the light. Okay, I'm gonna actually just put my glasses on for this. Okay, so carefully look at the light. Okay. Okay. Your eyes are not dilating. Have you taken any substances in the past day or so which would stop your eyes from dilating? It's okay to be honest here. It just helps me diagnose what's happening. No. Okay. Or have you taken any stimulants, coffee, any type of teas that could be interesting? Okay, no. Okay. You sure you haven't hit your head accidentally? Okay. Let me try that again. Maybe it's just my fault. Okay, can you look up? Okay, you can do that. Can you look down? What about here to the left? And what about to the right? What about up, down, left, right, up, down, left, right? Okay, look here. Okay, look here. Okay, look there. Okay, look there. Okay, so interesting. Can I just quickly test your eyes over here on the Snellen's chart? Okay. Okay. Can you read this first letter for me? What does that say? That's an E. Good. What if I move below? What does that look like to you? It's an F. Okay, and that's a P. Good. Let's move to the third line. Can you read that for me? So we're looking at T, O, and C. Good. So you can still see in front of you, right? Okay. Have you had any problems with blurry vision up close? So we have nearsighted or farsighted. Okay, so up close is more of the problem. Okay. Now what about the fourth line? Could you read that for me? Okay. L, P, E, and D. Okay, and what about the fifth line? Okay, you can still see that. So can you read up the 11th line at all? Okay. Okay, so it's nothing that's too far away from you, but it is more that it's up close. Okay. So I'm gonna quickly test your eyes with a color exam. And this is kind of a cool little thing. It is a light bulb that will switch colors. I'm going to ask you to just identify the color that I show you, okay? So I'm gonna put this right in front of you and tell me what color is this. Okay, so you see blue. Okay, that's red. Interesting. And what about this? You see green. That's yellow. Okay, interesting. What about now? What do you see? Okay. And you do see red. That's good. Interesting. I'm gonna switch that now. What is this? Okay, you see blue. That's actually pink. And what about that? Blue, but a little bit purpley. Okay, that's orange. And what about this? What do you see? Okay, so you're seeing like a green. That is also orange. And what about this? Okay, we're looking at like a light yellow. Okay, that's very interesting. So this one's pink. So I'm gonna actually ask you really quick. I'm gonna switch it to this color. Can you just look at this for me and follow it? Okay, keep following it. Okay, good. Interesting. So, look at that. Okay, I'm gonna switch the color one more time. Follow it again. Are you having problems where the color is changing depending on the angle that I shift the object to? Okay, that is typically a sign of something that we consider a symptom of a concussion or a problem with your cranial nerves, so that's probably with your eyes. So where are you seeing the shift in color? Is it in the center or is it to the sides? It's to the sides, okay? What about here? Can you see that difference there? You can. What about above? Yes, you can. And what about below? Okay, so it's out of your peripheral vision that you have the problems, okay? I actually do think I know what's happening here. So sometimes if you experience a pain or a shift in your neck when you sleep, you can actually experience symptoms of a concussion that can throw off quite literally everything. I remember one time I had very bad vertigo and I couldn't see anything. My whole vision was blurry and I couldn't walk and everything was a bit off. And it took just a couple of doctor's visits to fix that, okay? What we're gonna do next is a very common cranial nerve exam thing where we're gonna test your senses. And this is with your smell and your taste, okay? I have a ton of oils right here. They're very common smells. All of them are different. I want you to let me know what exactly you smell when you smell it, okay? There's no right answers, okay? But we just want you to get somewhere around the general parameter, okay? I'm gonna start off with the first one, and this one is a really common smell. I'm gonna ask if you're able to smell that. What do you smell? Cucumbers? Cucumbers? One more time, just to make sure. Okay, well, this one is orange. They're not really similar. Let's try a different one. We're gonna try some of the more strong smells. Okay, let's see if you can get this one. This one is, oh, this one's quite lovely. Okay, let's see if you can get the smell of that. That smells like wood. Like wood? Like fire? Like a fire pit? Okay, well this one is lemongrass. Let me get another, just to make sure. Okay, let's grab another one. Let's see here. Okay. I'm gonna try this one instead. Okay. And this one. Oh, this one's nice too. Okay. Let's get that from you. Anything that catches your sense of smell. A rose? This one's eucalyptus, like mint. Let me try that again. Do you not smell the mint at all? You do. Rose. Okay, you know what? Let's. Okay, one more time. Okay, let's try this one. I'm gonna shake the oil up. Okay, this one's very common. So you obviously could smell flowers. So let's see if you can get this one. Okay. What does that smell like? Coffee? Okay, this one is lavender. So your sense of smell might really be off. Okay, I'm gonna try something that's more of a fine-tuned smell because you're able to smell, but it's a little bit backwards. So I'm gonna try this one. Okay, what does this one smell like? Okay, that one kind of smells like old food. Okay, that's very interesting because I gave you toasted marshmallow, so at least it's in the food category, but that's supposed to kind of smell like a fire pit. Okay, I'm gonna try it now, just a taste test. So we have 3 different flavors. We have sweet, very sweet. We have sour, and we have something that's very spicy. And I'm only going to test you on 2 of them, and you let me know which one that you taste, okay? So we're going to first try this one right here. I'm going to just test it a little bit right there. Remember, either it is sweet, it is sour, or it is spicy. Put that on your tongue right there. Could you open your mouth for a second? Good. Okay, and anything? Okay, Nothing? Let me add a little bit more. Okay. And you let me know. Open your mouth. Good. And is it sweet, sour, or spicy? It's none. Okay. Well, that one was very sour. You were supposed to make a face that was like, but I do see that's not the case here. Let's try another one, okay? So we're gonna try this one. And I'm hoping this one works. Let's see. Okay, open your mouth. Go on. Okay, and sweet or spicy? Nothing. Okay, can you still taste food when you eat it? Not really. Does the food kind of taste a bit different when you do eat it? It does. Okay, maybe you could possibly be sick. Okay, well, so far we haven't found that anything was necessarily that good, so let's test your hearing in your ears really quick. Any problems with your hearing and ears? Yeah, okay. So I'm gonna just do a sound test. And I'm gonna ask you if you hear the sound from your left or your right side. I'm gonna ask you first to close your eyes, okay? Just close your eyes. And you let me know if the sound's coming from your left or your right side, okay? Let's begin with a beep test. Okay, left or your right side? Okay. And okay, left or your right side? Okay. Left or right side? Left or your right side? Okay, I'm gonna just move on with just my hand now. Tell me if it's from your left or your right side. Left or right? Okay. Left or right? So, it sounds like the audio is flipped. I'm gonna whisper something in your ear and I want you to whisper it back to me, okay? Apple. 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 Okay, so you got that, but what side did that come from, your left or your right? Let's try again. Star. 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 Left or right side? Okay. Let's try like right from here. Left or right side? Flipped. Left or right side? Flipped. Okay, so it just sounds like there's something just going on. I'm trying to figure this out. Not really that big of a problem. I'm just trying to figure this out. Maybe let's move on from testing your ears, okay? Yeah, I'm gonna need to do that. So nothing to worry about, even though this is kind of peculiar. So what I'm gonna do next is I'm gonna just give you a simple reflex test, okay? And this is just a reflex tool, if you can see that. What I do is I hit certain parts of the body and you see how the body like reacts, okay? And what we're gonna do is we're just gonna test different parts of your body. We're gonna first start off with your forehead, okay? And on your face, I'm gonna use just a bit of pressure with my fingers, and then on the rest of the body, just direct pressure, okay? So sit there. Here we go. Okay, nose, okay. The cheek, what about here? Okay, and on the nose. Okay, and on the mouth. Okay, right here on the neck, on the collarbone. Okay, what about here? On the shoulder? And on the shoulder. Okay, I'm gonna test this reflex of your arm. Can you hand me an arm? Good. Okay, no reflex. What about here? Okay, no reflex. Let's test your hand. Give me your hand. Thank you. No reflex. And over here? No reflex. Okay, can I test your knee? I'm gonna hit the part of your knee that'll make your leg flinch like that. Let's test. Okay, that was a little bit of a reflex. Not that bad. Okay, a little bit. I'll accept that one. Let's try the other one. Okay, not at all. Not at all. Okay, so at least one of the reflexed. Have you had any problems with your knees at all or getting injured on your legs? No? Okay, so I'm just going to write that down. So, moving on with just a bit more of the cranial nerve exam. I'm going to ask you to do something for me, okay? And this is a facial test. It's facial movements to see if you actually still have the ability to move your face. Can you lift your eyebrows for me like that? I'm very excited because I just touch your face while you do that, okay? Okay, and can you relax your eyebrows? Okay, they moved a little bit, but not a lot, which is interesting. Have you had Botox in your face? No. Okay, so I'm gonna write that. Just gonna write that down. Okay. Can you furrow your brows as if you were angry? I'm just gonna touch right there, okay? Okay. And relax. Okay, you could do that. That's not that bad, but it wasn't as detailed. Can you open your eyes very wide as if you were excited? Okay, I'm just gonna take a look right when you do that, okay? I'm just gonna take a look right when you do that, okay? Take a quick look when you do that. Okay. And can you close your eyes? Okay, that looked like a bit painful. Did it hurt a little bit? That's what I thought. Can you close your eyes really tight as if you're just squeezing your eyes? I'm gonna take a quick look while you do that as well. Okay, just gonna take a quick look. Okay, and I'm gonna ask you, can you open your eyes really wide? And I'm gonna try to squeeze your eyes shut. Can you resist? Good. Good. Okay, oh, okay, not that good, but you tried, which is good. So, first, can you just smile for me now? Just give me a very cheesy smile. How's a smile? Okay, can you frown? Okay, I'm just gonna write something down here. Okay, can you open your mouth and go, ah? Okay, you can do that, but not the smile. The cheek's not working. Okay, now can you tilt your neck like this? Ooh, does that hurt? Okay, can you tilt the other way? Okay, that looks like that hurts too. Okay, I'm gonna ask you to raise your shoulders. Can you do that for me? Okay, that's a little difficult. Okay, but can you try to resist me pushing down on them? Okay, resist in 3, 2, 1. Okay, resist. Okay, please resist in 3, 2, 1. Okay, one more time. Resist in 3, 2, 1. Okay, so no resist there. Were you able to resist? Okay, can I ask you to do a test for me? Can you squeeze my hand as strong as possible? So as if we were just sharing a handshake. Just squeeze my hand as strong as possible. Okay, 3, 2, 1. Okay, let's try the other hand. 3, 2, 1. Okay, I'm gonna put my hands right here on your biceps. Are you able to flex your arms for me? Okay, 3, 2, 1. Okay, one more time. 3, 2, 1. Okay, just a bit of difficulty doing that, I see. Okay, you can lift your arm up though, yeah? Okay, what about here? Okay, I'm gonna do a quick peripheral vision test. Will you let me know when you're unable to see my hand? I'm gonna just move my hand out of your peripheral vision, and you let me know when you're unable to see it in your visual field, okay? Let's begin. Okay. Okay. What about there? What about here? Okay. And okay. 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 So that is acting a little bit funny. That's interesting how went out of the peripheral vision a little bit too close. If I'm just gonna write that down just a little bit. Mind if I take a look at your eyes one more time? Thank you. Just gonna pull up my magnifying glass here. I'm gonna get a bit up close to your eye, okay? And I'm just gonna take a quick look right at your eye right there. So I'm just gonna take a look. Okay, let's look at the other one. Your eye is also not flinching. Okay, so okay, interesting, very peculiar. So what I think I'm going to do is I'm going to let you stay here at the clinic with us for just a week or so, see if you can recover manually or to heal. I was going to perform more exams, but it does seem that everything might be just a bit wrong with you right now, which is absolutely okay. We're going to find a solution for this, but based off your reaction times and how your cranial nerves were affected, your eye is not reacting to light. Some of the normal symptoms that we would consider to be very frequently normal and active have not been. Worries me just a little bit, okay? So I'm not going to lie to you there. We're just going to keep you in, and I'm going to keep you next to a nurse at night. If you need any help, we're going to ask you to contact them. There'll be a button right to the side of your bed, and I'll be back in just a couple hours to give you a similar exam, just because I wasn't satisfied with the results, and I want to see what we can do to make you feel better, to make you act, more normal again, and to make sure that you feel 100% again, okay? thank you so much for coming on by. I'm gonna have a nurse come back in and take you to the back, or we're gonna give you a private room. And there's a television there so you can watch whatever you'd like, but we're gonna see how this recovery process goes and if we can find out what's wrong with you. Okay? Perfect. Thank you so much. Again, I was just a little bit worried and concerned there just because some of those results were a little bit interesting that I've never seen before. So we'd love to just ask you to sit here and relax while I just write a couple of notes, which is a lot of notes. It's gonna be a lot of notes about your health. Okay? Thank you so much for coming on by. Cheers, have a good evening, and I will see you very soon because very clearly we need to.